Today I'm going to talk about dark spot on the skin and hyperpigmentation PicoLO laser treatment. First of all, I'm going to introduce myself. I'm specialized in general surgery, reconstructive surgery, aesthetic surgery, and minimal invasive procedures and laser technology. My titles summarizing are Professor, University of Buenos Aires School of Medicine, as Chief of Plastic Surgery Penal Hospital, and member of prestigious international medical societies. At this moment, my chairs are Medical Director of Hoogstra Medical Corporation and President also this company. I began to research in 1982 when I was resident in general surgery, and my team and I won several awards in the field of medical research. Since 1994, I have dedicated myself to working and conducting anatomopathology research and its clinical correlation on the scope and limitation of the use of laser technology. In 1998, I published blepharoplasty without scars and full face carbon dioxide laser rejuvenation, 4 years of experience. After more than 25 years of using laser technology, I was able to develop a unique technique in the world that is the rejuvenation of the eyelid without removing skin. The tightening and rejuvenation the entire anatomical unit with the use of carbon dioxide laser. At the same time, the use of very high energy fluency brought me a countless of unwanted effects like hyperpigmentation. We can see in this patient how I was able to tighten the lower eyelid, the upper eyelid, but this patient had hyperpigmentation here. Also, this patient was after a blepharoplasty without skin resection, tightening the skin with carbon dioxide laser. Dark spots on the skin and hyperpigmentation PicoLO laser treatment. We can see this hyperpigmentation after CO2 laser, and this is the blanching with a PicoLO laser 6-section 1064. Many medical doctors ask me the frequency to use PicoLO laser, and I can say you can use each day, you can use one a week, if 15 days, 30 days. The question is you don't use in a high power to produce irritation of the skin. You must to use softly. Fractional is very good, fractional 1064, and you move and you don't produce a redness, because if you produce redness at the same time you are going to fractional the pigment, also you are going to produce an irritation of the skin, and the irritation of the skin bring or stimulate melanogenesis. And this is after 6 sessions. I removed in 1 month. This is the patient, and this is 1 month treat with a PicoLO laser. This is another treatment with 1064. And one of the biggest challenges for any technology is the hyperpigmentation of very dark skin, like the African skin. This patient came to Argentina looking for a blepharoplasty without skin resection. You know, this patient, African patient, developed hypertrophic ankylosing lesions in the area you remove the skin. And this patient know about my technique and come to Argentina. But after the tightening the skin with carbon dioxide laser, have a severe hyperventilation. But I know it that this was happen, and this is after 6 sessions with 1064 fractional handpiece, and also you can see the tightening the skin, no scar for the blepharoplasty, and here you can see the skin blacker than this, and you can see here the skin after the PicoLO laser whiter than the frontal area. Facial solar lentigos are very frequently. I use the 532 mode, and this patient come from outside of the country, and I get the result just with one session, and this is the result 14 after the procedure. The 532 produce at the first moment a blanching of the lentigo. After that, producing a crust like a black one that peel off in 10 days, and then this is the result. Just one session with 532. In this patient that have not only lentigos, have photoaging of the skin, I usually use 1064 fractional handpiece in the full face, and I finish with 532 in the lentigo area. In this way, I can blanch and produce photorejuvenation of the full skin, and also remove the lentigo in one session. Generally, for improving the quality of the skin and just produce a collagenesis, I need several sessions with 1064. You can use each 15 days, but this dark spot I can remove solar lentigo, or I can remove it just in one session. You can see the blanching of the skin, the improvement of the post-operative of the skin with the laser. It's rare to have side effect with this. It's just almost you can. The good thing is with this kind of laser, each patient that comes to your office is a patient that needs this kind of laser. But all the patients have some degree of photoaging, and with this laser you can improve the quality of the skin, you can blanch the skin with any side effects, and the patient can go on immediately with their regular activities, go to the gym, can go to the work. And it's very interesting because when we medical doctors buy a laser, we must to understand how many treatments we can use, in what time we can recover the investment. And generally it's a good thing, one equipment like this that we can use in many patients. As I said, each patient that comes to my office is a candidate for this procedure. And also I'm going to show many other treatments that I can use with the equipment. And this is another case with the lentigo, pre and post. Hand solar lentigos is very frequent, and is sign of aging, photoaging. And here is like a white spot is immediately after. After that begin dark and then they peel off. And in this patient with hyperkeratosis, I use both PicoLO laser to blanch the skin and Lotus laser to remove the hyperkeratosis. And we can get this result. Hyperpigmentation produced by intense pulse light made for epilation. The patient have a lot of anguish because want to have an epilation, have this hyperpigmentation after the procedure, and this is the result. Get it with 2 sessions with 1064 fractional modality PicoLO laser. Gluteal hyperpigmentation after iron injection was almost impossible to improve. I have a lot of experience with this kind of technology. Generally take nearly 8 sessions with fractional 1064. The results are very nice, no complication, no downtime, and the patients are very happy because there are no other centers that can offer this kind of solution. Here we can see pre and post, and this is a rare case. It's a Peutz-Jeghers syndrome. The patient have tumors in the bowels, benign or malignant, and this kind of hyperpigmentation is pathognomonical in the lip area and also in the face, in the hand, and this is just 2 sessions with PicoLO laser modality 1064 fractional handpiece. This is melanin. I really don't know if this pathology is described in another centers, but these patients are very nervous and friction one finger with the other, and this produces stimulation of the melanin. This is the result I get with just 1 session with the PicoLO laser. We can see the result. The differential diagnosis must be with melanoma, no? But if you see this line here, is just the product of friction, and also this hyperkeratosis here. There are no gaps. This is not a melanoma. This is production of the stimulation of the melanin for friction, for rubbing. My team using a lot of whitening of this area, genital, also the axilla. That area have fractional, and this is very frequently patient that may a hyperpigmentation by epilation with hot wax is very frequently here in Buenos Aires, Argentina, and after several sessions we can improve. And the vitiligo I'm not going to improve, but also improve the surrounding area that have more hyperpigmentation. We have a lot of experience with burn scars. The hypertrophic lesion I treat with Lotus laser, We have unbelievable results. I'm going to present this in another chapter that I speak about erbium laser, lotus laser to improve the hyperpigmentation that post-burn, but also the post-burn have hyperpigmentation that I improve with PicoLO or Helios laser and have unbelievable result with this kind of combination. Dark circles, the patient need several sessions but improve the quality of the skin of the lower eyelid, that they go another centers and said they have no solution, and I and my team we get an improvement with the laser. Melasma is, melasma on cloasma is after the delivery, and the patient have this dark spot in the area that are most exposed to the sun, like the frontal area, the chin area, the cheek area, and the patient are not, they feel insecure, After the delivery, the women are in another situation and have this hyperpigmentation, produce a psychological depression to this patient. You can see her eyes, but this after the procedure, the patient look very happy. This day nearly in my country, in my personal experience, just take no less than 12-15 sessions. Generally, we do 15 days each. And also you must remember, don't use the laser with a high energy, don't irritate the skin, because you are, for one hand, you are removing the pigment, and for another side, you are stimulate the melanogenesis. The secret of the PicoLO laser is a diffractive diode, provide a uniform fluency and the same depth penetration. Here we can see 81 microbeams, and this is a painless and quickly procedure. And this is the difference with another laser. The fragmentation are very thick, very big, and this is small with the PicoLO laser. And have several handpieces to produce different kind of treatment. You will briefly receive information to subscribe to my educational channel, where I will develop not only the results obtained with the technology, but also how to use it appropriately to obtain the best result with it. You can subscribe at my website, or just can go to the YouTube channel here, and you can subscribe for an educative, and this is educative channel is free of charge. It's very interesting because I'm going to develop different kind of pathology and treatment. I'm going to speak charcoal peel, onychomycosis with 1064. I have a lot of years of experience in tattoos, hypertrophic scar produced by allergic reaction of the red skin. I developed a special treatment, just not only to remove the black, the red, but also to improve the hypertrophic reaction the keloid reaction that was produced by the red ink, and this is the result. Medical doctor need company to invest and research to develop new technology, but at the same way, company need people like me to develop scientific investigation and to get the best result with each technology. I'm working in this subject more than 25 years, and I developed new procedures like melanocytus nevus. The PicoLO Helios was not prepared, was not done to remove this kind of nevus because the energy is very, very superficial. But if I use in a special way that I can remove this nevus in a safer way that if I use another procedure. Also, I'm going to talk about my research in other technology like HIFU and my research in another kind of procedures. I developed acne rosacea with HIFU, procedure that was very difficult to treat. And in my educative channel, I'm going to develop my personal research with different technology. See you soon.